As many as 1 in 10 women today have a condition called Polycystic Ovary Syndrome. This syndrome includes 3 factors: irregular periods, imbalance in hormones, which includes too much testosterone or testosterone-like effects such as acne and either excessive hair growth or hair loss, and thirdly, it involves the formation of little cysts on the ovaries. In fact, sometimes they may not be so little. In fact, I had a patient I treated a few years ago who was 31 years old, and she'd been to the emergency room 3 times in the past year and a half because those cysts would get so big, they would suddenly rupture, and she would have extreme pain and have to go to the emergency room. And when she came to me, she said, "I really don't want to go through that again. What can you do?" So from a modern medical point of view, perhaps not much that would prevent that. But from an Ayurvedic point of view, Ayurveda being the natural health system of India, we have understanding of this imbalance that is there in the hormones as well as the formation of cysts as involving factors that we can influence through a woman's diet and herbs and lifestyle. In fact, modern medicine is also recognizing the impact of diet, and it's calling this condition a metabolic malady. And that means that not only are the reproductive hormones out of balance, but it's been discovered that metabolism in general is out of balance, particularly difficulty with handling sugar and carbohydrates. In fact, these women often have pre-diabetic signs of insulin resistance. They have an increased risk of heart disease and also of diabetes and uterine cancer. So it's really important to balance the whole system, not just treat it as if it were, say, irregular periods and give a birth control pill, for example. So it actually is of genetic origin, probably. But as most genetic conditions we've learned, they can be influenced greatly by epigenetic factors such as our diet and our lifestyle. So in this case, I looked at this lady's overall diet and health, and we saw that she was really having a lot of carbohydrates and quite a bit of sugar binges. So we cut that out immediately, and I gave her some herbal program that was very tailored to what I found in her pulse, which is the Ayurvedic way of understanding a person's individuality and what's out of balance and causing the symptoms in them. And also, I put her on a regimen of boiled hot water, which anybody can do, that helps to open the channels of the body, helps to flush out the impurities, promote good bowel movements, and good cleansing from the intestines. Because from the Ayurvedic point of view, our metabolism of hormones is also influenced by our liver. Conventional medicine would say that also, as well as the elimination through the bowels, because otherwise hormones can get reabsorbed. So we want those waste hormones to go out of the body and not build up in the system. So one of the recommendations I would make for anyone dealing with this condition is to try these dietary changes, as well as perhaps to consider taking a product called Organic Digestone or Triphala Plus, which is a traditional Ayurvedic herb made of 3 fruits, dried and put into a tablet, and when taken helps the elimination. It also has many rejuvenating effects on the body, but it helps to remove what we say in Ayurveda is ama, or waste and accumulation that blocks the tissues. And it's these blocks that cause cysts to form anywhere in the body where the fluid that's being produced in the tissues cannot get out. So it gets stuck and it builds up and it forms this little fluid-filled cyst. So Ayurveda would recommend measures to clear all these accumulated waste through hot water, through clean, healthy diet with lots of fresh fruits and vegetables. Consider the herb Triphala Plus or Organic Digestone, and eat more greens, and generally have a healthy lifestyle with good sleep and good exercise, and reducing those carbohydrates in the diet. And the last thing I would say is that polycystic ovary syndrome can be overcome And the infertility that can come from it can also be overcome, as was shown by my patient who 3 years later now has not been to the emergency room, got rid of her acne, and now is enjoying a healthy pregnancy.